It's not always easy to know when you need a knee replacement. The decision to have one should be done in consultation with your doctor. He or she will consider factors like your X-ray or MRI results, how your knee is functioning physically, your personal health history, and your weight. Here are some other important considerations you and your doctor should discuss. Is your pain severe, even when you're not using your knee, such as when you're sitting still or lying down? Does it hurt day and night? Are you experiencing a lot of difficulty and pain performing simple tasks like dressing, bathing, getting out of bed or a chair, or climbing stairs? Do you need the help of a cane or a walker to get around? Are you already taking pain medications, especially strong ones, and they don't help ease your discomfort? Have you tried other less invasive treatment options that haven't worked? These could include cortisone injections, lubricating injections, rest, and physical therapy. Is your knee showing signs of deformity? If this is the case, definitely talk with your doctor sooner rather than later. Are you between 50 and 80 years old? Age is not necessarily a deciding factor, but most people who have knee replacements are in this age range. Very often, individuals who need a knee replacement have a condition called osteoarthritis. This happens when the cartilage that cushions the knee joint grows thinner due to age and use. Eventually, bones in the knee start rubbing against one another, causing discomfort and decreased mobility. Another condition, known as rheumatoid arthritis, often causes chronic joint inflammation too, leading to chronic pain. Of course, sometimes knee replacements need to be done due to injuries that limit knee function. Such injuries often occur during sports activity or as the result of accidents.